Good evening. Back from my hiatus. I was in Japan for a couple of weeks on an amazing hiking adventure and cultural tour. Japan is another universe if you've never been there. It's amazing. Excellent food, excellent people. Tell a little bit more about it as we go, but jump right in because you guys had a lot of questions on my absence here. So, first question up tonight. What are my thoughts on Spermidine, particularly a particular brand? As a supplement for mitochondrial health. Have no personal experience with the supplement. A couple of my patients do take it. It may help with ATP production and mitophagy. So possible benefit, but most of the data looks like it's in animals and soul, not a lot of human data. So I put it low on the bucket of things to consider for the stack. If you've already optimized your sunlight exposure, you've potentially done cold plunges, you may be using photomodulation, then maybe consider it. Sleep's got to be dialed in, exercise got to be dialed in, then maybe consider. But I'd want to see more human studies before saying more people should consider it. Question about thoughts on the blue sync glasses from Raw Optics. Wasn't familiar with them. Looked them up. Raw Optics was a brand that I used to use routinely. Had some issues with some of the lenses scratching up pretty easily, so I stopped using them personally. Mostly use EMR Tech now at this time personally. But when I looked them up, they look like they're glasses that are mostly used for outside, exposure, particularly if you have high UV light. I don't think I would personally would invest in a pair. I don't want to block any wavelengths of light reaching my eyes when I'm outside. If I was stuck, on an ocean or skiing and the sun was bouncing off the snow, bouncing my eyes, maybe I'd consider these glasses for that point. But they look like basically just fancy sunglasses, that do let some blue light through, so your circadian rhythms are maintained. It is reportedly developed in collaboration with Dr. Alexander Wunsch, who's an amazing physician, light researcher. I've actually had the pleasure to hear one of his speeches in Germany a few years ago at a biohacking event. So interesting, but I'm not going to utilize them or necessarily recommend them to anybody. Question, relationship between getting a stent and then needing hip replacement a few years later. Not directly from the stent. It would depend a little bit, on what other comorbidities you have. If you have avascular necrosis of the hip, that can, be a vascular issue that, required the hip being replaced, but the stent wouldn't directly cause it. Some patients, if they end up on warfarin, may have some more issues, but warfarin is not common after stents, so not likely related. And is it possible for people with high LPLA, are they more likely to have a Frank's ear or Frank sign? I don't know that there's any literature that points towards that. The Frank sign is a diagonal crease in your earlobe that is associated with increased risk of atherosclerosis or plaque in your arteries. But high LPA by itself increases the risk of plaque in the arteries. So look at the arteries directly. Are there concerns for cognitive dysfunction with total cholesterol less than 100, especially with a ApoE4 allele? I don't typically follow total cholesterol for that. I would look at more your desmosterol levels, and I know that's kind of a follow-up question that you added. So look at desmosterol. When you're looking at total cholesterol, you're only looking at 5% of the cholesterol burden in the entire body. What's actively floating in the lumen of the blood at that time. The majority of the cholesterol is inside the cells, which is not measurable. So your blood level doesn't really, interpret what's going on inside your cells. But if you feel that you're having brain fog, memory issues, then talk to your doctor about potentially reducing the dose or using a different agent to work on the lipoproteins. What desmosterol level is too low with an ApoE4 allele, and on a statin regarding dementia risk. So I don't know the absolute level of desmosterol, but if you're doing the Boston Heart Lab panel, which is the one that measures desmosterol, it's the cholesterol balance test. If the desmosterol level is in the red zone, then you generally need to back off of the dose of the statin. Or if the patient's not tolerating the statin, and there are hyperproducer sterols for that, then use Nexletol, which is also known as bempedoic acid. But dementia is, polygenic. It's, generally not. It generally is multifactorial. So dementia, in my mind, is a combination of cardiometabolic disease, insulin resistance in the brain, inflammation in the brain, atherosclerosis in the brain. So you're trying to treat all those risk factors. And statins are just one of those tools. If the person can't tolerate the statin, use a different tool. All right. See some familiar faces here. Welcome, guys. So somebody says their EKG now has signs of left atrial enlargement after months of multiple atrial fibrillation episodes. Is the EKG reliable for this, or repeat an echo? I would repeat an echo. The EKG is not that reliable at assessing left atrial enlargement. It would depend on where the leads are placed. You want to know what your left atrial volume index is on the echo, and if there's any evidence of any pulmonary hypertension. Next question, why do so many influencers claim that having a high LDL is not bad? It is a bit misleading. I would concur with that assessment, as I might talk about frequently when I'm on other people's podcasts. So it's more complex than good cholesterol, bad cholesterol. It's much more important to look at endothelial dysfunction and looking at plaque in the arteries. You have 60,000 miles of arteries. If you have plaque, treat the plaque. You're not just treating what's in the blood. Is it not bad? Well, if you have a healthy endothelium, low oxidative stress, low inflammation, metabolically healthy, not insulin resistant, then the lipoproteins may not be as problematic, but they still can be, if they're getting retained in the intima and causing intimal swelling and inflammation in the artery of the lining. So looking at what's in your blood isn't going to tell you necessarily what's going on in your arteries. Next question up tonight. Does sugar need to be totally eliminated from your diet if you have high triglycerides? I would say not necessarily. You would have to know, are there other reasons why the triglycerides are high? Is there a thyroid issue? Is there a medication that you're on that's increasing triglycerides? Are you insulin resistant? Do you have a fasting insulin greater than 8, hemoglobin A1C greater than 5.1? Do you consume alcohol, to excess? Those are things that you can look at in your lifestyle. But I've seen patients that if, they're not insulin resistant, that have high triglycerides, there can be a genetic predisposition. Often those patients have an issue with lipoprotein lipase, or LPL. You can check it with a GB Insight panel to figure out if your triglycerides are elevated because of a genetic abnormality. Question about tips for vascular issues post-COVID is somewhat of a endothelial issue. The spike proteins would damage the glycocalyx and the underlying endothelium. So COVID is a atherosclerotic promoting virus. So same compounds that we use to treat people with vascular disease from non-COVID reasons is what we would utilize. We'd do things that would boost nitric oxide, support the glycocalyx, help lower oxidative stress and inflammation, and then treat lipoproteins as necessary. But mostly for that, it's nitric oxide optimization and potentially a glycocalyx promoter. What are the target LDL and total cholesterol numbers following cabbage? And then question mark Repatha. Traditional guidelines would probably tell you that your LDL cholesterol should be less than 55 in that instance. Total cholesterol, no real guidelines for, but I would look at more your ApoB containing particles. I would generally shoot for somebody who's had bypass surgery for an ApoB less than 55, which would be the 5th percentile. Oftentimes, a PCSK9 inhibitor like Repatha will be utilized in those individuals if they're on maximally tolerated statin and not at goal. And they may add ezetimibe as well. And then if they're not at goal with ezetimibe plus statin, then add in the Repatha. Next question up. Person is a 56-year-old plant-based eater, has an elevated LPA over 300. What can you do to naturally lower LPA? Generally, if you have normal inflammatory markers, so normal hsCRP, normal LP-platelet activity, normal myeloperoxidase, probably not much you're going to be able to do to lower LPA. Inflammation is one of the biggest things that drives it. There are drugs in development, currently 5, waiting the phase 3 trials from the FDA to say that these drugs will be approved. They lower LPA by 99%. So generally, one of these medicines should be out on the market sometime this year. In the interim, the goal is optimize endothelial function, keeping nitric oxide optimal, keep oxidative stress and inflammation low, and you can check that in blood work. And then treat your other LDL particles. Those also have ApoB. Treat that ApoB down to probably at least less than 70. If you already have plaque in your arteries, probably less than 55. Next question, does any amount of blue light at night disturb your circadian cycles? Yes, potentially. Your retina is sensitive reportedly to 5 photons of light. There's a study, somewhat debunked in some cases, but still out there, that they were putting LEDs on the back of people's knees, so the room was dark, but the light was on their skin alone. Those people had worse sleep than the people who had the kind of the placebo light where no light was turned on. So your bedroom should be so dark you can't see your hand in front of your face is the goal. So thus, wear your glasses post sunset until you go to bed and make your room dark and cold. Next question, how do you know if your arteries are clear? What tests can you have? So you must be a relatively new follower. This is something I talk about routinely, and this is something I do with every patient that sees me at Apollo Cardiology. So we start with endothelial function testing. You can kind of a idea if you have good endothelial function by checking your blood pressure at home. Blood pressure should be less than 120/80, but ideally you have access to doing something that looks at your central aortic blood pressure, and that's the pressure that really needs to be optimized. You can look at pulse wave velocity, so how stiff are your arteries. There's various devices that do that. The salivary nitric oxide test strips, they're interesting but not definitive, so generally want your levels to be optimal on that. Then in our office, we use a device called the Endopat, which assesses for reactive hyperemia, so how much blood flow dilates your arteries with the vascular stressor. That tells you how much nitric oxide your arteries are releasing. Then you actually go look for plaque. So 60,000 miles of blood vessels, head to toe. Carotid intimal medial thickness testing can look for inflammation and plaque in the carotid arteries. For the coronary arteries, you can do a CT coronary calcium score, or more sensitive would be a CT coronary angiogram, particularly if you add AI analysis with clearly. Looking for a triple A, abdominal aortic aneurysm. Looking at ankle brachial indexes, blood pressure cuffs on your arms versus blood pressure cuffs on your ankles. Divide the ratio. That score should be between 1 and 1.4. If it's less than 0.9, you may have plaque or blockages in the arteries going down to your legs. So those are the starting points to look at if your arteries are all clear. And then I did see a question about Japan. I'll save that one for the end. So this might have been your question. So you said the heart is clear. So does grounding help the heart? Yes. Adding electrons in through your system helps lower oxidative stress, balances the autonomic nervous system, so activates the parasympathetic response. So grounding definitely can help. Is it okay to add electrolytes to the water to take the thyroid hormone? You'd have to talk to your doctor who's prescribing the thyroid hormone if they're okay with it, but generally you should just take it with regular water because you shouldn't have anything that could interact with the thyroid hormone for at least an hour after taking it. what's the best way to test for familial hyperlipidemia? There's genetic testing from multiple companies. I tend to prefer the GB Insight panel because I look at over 100 different genes, because not everybody's going to have monogenic FH where you have one gene giving you familial hyperlipidemia. There's some people that have polygenic causes. So I tend to like the GB Insight panel, but some of the other companies out there can look at some of the genes as well. Quest is able to do some of them. And then I can't remember the name of it, but ultimately I think it's, GeneDx, I think, is the other main company that does them, but I haven't used them in many years, so I don't know what the panel looks like these days. All right, so the last question I saved was somebody that tells you about Japan. It was amazing. I'd highly recommend people go there if they ever get the chance. The culture is very unique. The people are very warm and serving. I had a great experience. Extremely safe. I don't know if I've ever felt safer in a bigger city. Tokyo has nearly 38 million people. Never felt unsafe, even out at night. Very good food. I ate more seafood in 2 weeks than I would normally eat in probably 2 months. Seafood was offered pretty much at every single meal. Conveyor belt sushi is a thing there. It's awesome. You just pick off the conveyor belt what you want. But mostly was ordering some premium cuts of tuna sashimi, which was amazing. And their beef is also outstanding. So Wagyu and Kobe beef, are highly prized there. Did get a chance to try it a couple times. It is amazing. Is it better than any steak you've ever had? Probably not, but it's definitely worth a shot if you get access to it. And I'm probably 90% over the jet lag coming back. It was pretty crazy because left at like 5 p.m. Saturday and got home at 3 p.m. Saturday. So, trying to jump back in time essentially. So, generally I can get back on track within 24 or 48 hours. So, use the time shifter app on the plane to know when to sleep, when to block blue light, when to take caffeine, and generally follow it pretty closely. So, did take kind of a down day today. Worked out this afternoon to kind of build up adenosine, so get some sleep pressure going on later tonight. And after I'm done chatting with you guys, going to go outside for kind of a sunset walk so that light cycles drop. Continue to wear my glasses post sunset, and hopefully get some good sleep tonight and back to Apollo Cardiology tomorrow, and keep helping people reduce the risk of having heart attacks and strokes. And then I think there's one last question that popped up. So, thoughts on chelation therapy to reverse plaque accumulation? There's no data that actually happens. The TAC2 trial was released in April of 2024, and I was in the attendance of that trial release. And there is no data that chelation therapy reversed plaque in people. In the original TAC trial, there was a signal that diabetics tended to benefit. So if you have an acute exposure, that's a different story. If you work in a foundry and are exposed to something, then definitely chelation may help with lower oxidative stress and inflammation. But for all comers, no, the data is not there. Did I drink lots of green tea or ceremonial matcha? Not a lot, but a decent amount. I'm more of a coffee drinker in the morning times, and their culture there is pretty interesting. Is that there's over 5 million vending machines in the country. The majority of them out in public, and you just can use your Suica card, which is your transit card, so like Apple Pay on your phone, and you can buy drinks. Their canned coffee. They have cans that are hot inside the vending machine. Crazy technology that they apparently invented back in the 1970s. My particular favorite was the Boss brand. The Premium Boss was outstanding. If I could get access to it here in the States, I probably would start importing it. But I did get to see some green tea and matcha ceremonies. It was awesome, and it was a great experience. All right, guys. Well, I'm glad I'm back in the States. I'm glad you guys are here asking good questions. I try not to go on these long adventures except for maybe once or twice a year. But it was amazing to kind of unplug, connect with nature. The bamboo forests in Japan were amazing. Hike the way of the samurai, the Nara deer, or another big thing. I'll try to drop some of those things in my stories over the next day or two. But thank you guys for your time and attention as always. And I'll be back next Monday, 6 p.m. Central Time.